Millions of people around the world struggle with cocaine use every single day. From Scarface to Pablo Escobar, cocaine is a very harmful addictive substance. People struggling with bipolar disorder have some of the highest rates of substance use and cocaine addiction across all psychiatric disorders. So how could a supplement containing Citicoline possibly help? Let's look at one of the studies. In a randomized placebo-controlled trial, 44 people struggling with bipolar disorder and cocaine addiction were given 2,000 milligrams of Citicoline a day for 12 weeks. Participants continued to take their usual psychiatric medication throughout the length of the study. The study was originally looking at memory, but they also used the number of self-reported days of cocaine use per week with urine tests to verify. Assessments looking at verbal learning and memory, cocaine use, and depression and mania were done at baseline and with a follow-up every week. What they found was the group receiving Citicoline had improvements in learning and memory and a 70% reduction in cocaine use over the course of 12 weeks. In practical terms, it meant people went from using cocaine 2.5 days per week down to 0.7 days per week. The placebo group also showed a reduction in cocaine use from around 2.4 days per week down to 1.8 days per week. In absolute terms, when comparing the two groups, taking Citicoline reduced cocaine use by about 1 day per week. Reported cravings also coincided with less cocaine use, meaning that the lower the craving, the less the use. Lastly, no changes in mood or depression and mania were reported through the course of the study, and there was no major side effects. It is worthy to note that a follow-up study with 130 patients noted a 15% decrease in cocaine use at the beginning of the study. However, that kind of leveled off towards the end, showing no major significant difference. So what's the takeaway? Well, it appears at least one study, high doses of Citicoline can improve verbal learning and memory and reduce craving and use of Charlie Sheen's favorite drug, cocaine. Mechanistically, Citicoline does this by improving dopamine synthesis, something that chronic cocaine use can disrupt. Citicoline use can also help repair certain neural circuits in places like the prefrontal cortex and the limbic system, two key areas that are often disrupted during chronic drug use. So if you or anybody else you know is struggling with chronic cocaine use, supplementing with Citicoline may help reduce the amount of cocaine used per week and slightly alleviate some of those cravings.